This is Dr. James, and today I'd like to talk about strep throat, more specifically, the treatment of strep throat. I don't know if you're seeing this out in the community, but definitely as a pediatrician, I'm seeing this. For years, in fact, when I got out of residency, they told us that there had never been a case of strep throat that was resistant to penicillin. So penicillin was the recommended dose, was the recommended antibiotic for everyone, unless you were allergic to it. Well, now we are seeing resistance to penicillin. So we had gotten to where we used a lot of amoxicillin or augmentin for strep. Usually it was amoxicillin. And we kind of reserved bicillin, the shot, for kids that were throwing up or kids that refused to take their antibiotic. But now we are on a weekly basis, if not even more than once a week, seeing kids that are on antibiotics who are not getting better with strep or have taken the entire course of the antibiotics, still sick and testing positive for strep. That's something we hadn't seen, especially not in these numbers. So now, as you are going to the doctor and getting treated for strep, still the recommended treatment is penicillin, and so you're going to see us start that. It's not a difference between whether it works with your kid or not. Is the bacteria strain of strep that they got, is it sensitive? If your kid isn't starting to turn the corner after 3 days or so of the antibiotics, you probably need to let your doctor know, because we may need to change that. And it may be time that we start reevaluating strep and the drugs that work best for it. Because, well, now's the time, because we're definitely seeing a rise. And we don't want to start seeing a rise in things like rheumatic fever, which is a complication of untreated strep. Other things that you can hear about are things like your kidney diseases, like post-streptococcal glomerulonephritis. Now that doesn't have anything to do with whether you treat it or not. So if you're seeing an increase in that, don't necessarily attribute that to the antibiotics not working. That's something that's always been there. But if we start seeing more rheumatic fever because our antibiotics not working, we have a problem. So kind of pay attention. You're gonna have to watch your kid more when they have strep, make sure they're getting better. If they're not, go back and see the doctor.